If you have a diagnostic test coming up and you're feeling stressed, anxious, or completely overwhelmed, take a deep breath with me. In, out. Let's take it one more time. I am exactly where you are. The panic feeling of, I feel like I don't know enough. What if I fail? I get it. But here's the thing. Diagnostic tests are designed to help you, not hurt you. In the next 10 to 20 minutes, I'm going to walk you through exactly what to prepare for, how to prepare, what to focus on, and most importantly, how to calm those nerves so you can show up and do your best. If this video helped you, please like, share, and subscribe. For more nursing student tips and every other thing I do so many things. So just check my channel, look it out. Let's do this together. You got this. Now, let's talk about what the diagnostic text actually is. A diagnostic text is basically a check-in. It's done in the beginning of your last semester in nursing student. So we're currently doing it in the second week of our semester, of our last semester. Your professors want to see where you are right now, what concept you understand, and what areas where you need more focus. It's not a final exam. It's not a pass or fail. It's more like a diagnostic. Oh, think of it when you do your annual checkup. It's like a health checkup for your knowledge of all the things you have learned in nursing school. So before you spiral into a panic mode like I did earlier, remember this test is a tool to help you succeed, not a judgment of your words as a future nurse. So basically, diagnostic is a learning tool, not your final grade. It's done early in the semester to know what you need to work on and to better prepare you for NCLEX, which is the licensure exam you take as a nurse. Now, let's talk more about how to prepare smart, not hard, because it's 2026 and we do it the smart way. Okay? I have some tips to share with you. So my tip number one for you would be to focus on high yield topics. Now I'm in the library, so you might hear background noise, but bear with me. The main focus is to hear what I have to say. Now, you need to focus on high yield topics. Don't try to review everything, because if you're going to do that, that's the whole 5 semesters or how many semesters you've been in nursing school. That's your fundamentals, that's your maternal, that's your med-surg 1 and 2, critical care, gerontology, psych, pediatrics, am I missing anyone? I feel like fundamentals, pharmacology, pathophysiology, even your prereqs like your anatomy and physiology. Yeah, you can do all of that. You can do all of that. So basically, you want to focus on the most commonly tested area. So for fundamentals, diagnostic, you want to review your vital signs and assessment. You want to know what is expected versus unexpected. You want to know your vital signs, your range for both adults and kids. You want to know your infection control and safety. You want to know your medication administration basically like the 7 or is it 9 now of right of medication administration, patient communication, therapeutic way. And for your med-surg diagnostic, you want to know your cardiac and respiratory basics, your diabetic management, fluid and electrolyte imbalances, pain management. And then all of this, remember, it's going to be accent and NCLEX-Style. And you want to know your prioritizations, your ABC, airway, breathing, circulation, delegation, that's your RN versus LVN or LPN according to NCLEX versus UAP scope. You want to know your safety and infection control, and you want to know your patient's rights. I literally have my schedule, and this is I don't know if you guys have this. Oh yeah, you can see. This is the decision 3 of how you can answer question, topic, strategy, priority versus evaluation question, and then the outcome. This is a video for another day. Right now, I just want to come in for the diagnostic. So you want to focus 80% of your study time on these high-yield areas. They show up on almost every diagnostic test. Your tip number 2 is to use NCLEX decision trees, like I have right here. So when you need to watch videos that explain detail and how to properly utilize it in your questioning. So when you see a question, you use this decision tree. Now, is it a safety issue, or is it you need to address immediately? You need to use your step 2, use your ABC, airway, breathing, circulation, and you want to think Maslow, the triangle. Is it physiological or psychological? Remember, psychological needs first. And you want to assess before action. You never implement before assessing. Now, this framework works for like 80% of the diagnostic questions. Example, which patients should you see first? That's a priority question. And now, when it says which patients should you see first, it's under priority client. And then if it's under priority client, you need to know if it's stable versus unstable, expected versus unexpected, ABCs, acute versus chronic, and actual versus potential. Now, when you use your ABC, who has the airway, breathing, circulation problem, you practice critical thinking this way and you'll feel so much confidence. Now, tip number 3, you should review, don't cram. You already know this. Trust your brain. You have literally been in nursing school all this while, crying, suffering, all of that. Understanding this. So your brain literally knows it. It just needs to be reminded. If your diagnostic is tomorrow, like mine, cramming won't help you. Instead, do a light review. Skim your notes if you're the one that takes notes like me, or if you have the tablets where you write your notes. However you take your notes, whatever works for you. Review it for 30 to 45 minutes. Review key concepts, not details. Just have a general idea of the key concept. Do 10 to 15 practice questions max, then stop. Your brain needs rest to perform well. Cramming creates and adds more to your anxiety and actually affects and hurts your performance. You need to trust your work. You need to trust the work you've already done. You know more than you think. Like today I was doing the practice, reviewing the practice question, and I finished. I was like, Lord, I hope I didn't do bad. And then I checked and I only missed one. And it was the one I missed was the one where I last minute second guessed myself. So I could have gotten everything in that 20 question practice review I did. But because I second guessed myself in one of it, I missed that one. And I was like, you know more than you think. Like it was mind-blowing. It even improved my confidence in myself, in my brain, in my ability to properly do well in my diagnostic test. So like I said, do a few practice questions. 4 practice questions are your bestie. For the rest, do a few practice questions, but focus on understanding the why answers are right or wrong, not memorizing the questions. Basically, you need to read the rationale and understand it. The explanation teach you to think like a nurse, which is what the diagnostic test measure. Now, quality over quantity. 10 questions understood deeply beat 50 questions rushed through. Tip number 5, you want to prepare physically. Your brain works better when your body is cared for. This is self-care. Remember, I'm a self-care enthusiast. The night before, you want to eat good dinner. You want to lay out your clothing materials so you don't have to worry about them the morning you wake up. You want to set 2 alarms. I normally wake up by 5, but whatever works for you. But I have a 4:30 a.m. alarm and then I have a 5 a.m. alarm. So in case one day work, the next one wake me up. But naturally, my body wakes up. My brain knows to wake up at that time because I have gotten a good 7 to 8 hours of sleep because I sleep 9 p.m. So It works. Get 7 to 8 hours of sleep. Seriously, you need that. The morning of, if you're someone that eat breakfast with protein, hydrate with water. If you want to put some electrolytes in it, do so. If you want to put some flavor because it's winter period and you don't get thirsty, do whatever makes you be able to drink water and hydrate well. You want to avoid too much caffeine. It increases anxiety. You want to arrive 10 to 15 minutes early because physical preparation is mental clarity. Now, also, quick heads up. I think I forgot to say this earlier. The diagnostic test is basically like preparing for like NCLEX, and it has 150 questions. Yeah, marks of NCLEX. You have to do the 150. It's not like NCLEX that you 150 questions, and you do it in 3 hours. Yeah, the max on NCLEX is 5 hours, but your school is going to train you. It's going to prepare you to not use all the amount. So, all 50 questions in 3 hours. So, you need to be well prepared for that because you're going to be sitting down for a long period of time. You get what I mean? Now, tip number 6, you want to manage test anxiety. Let's talk about calming those nerves. Before the test, take 5 deep breaths. In for 4, hold for 4, out for 4, like that. And then, like that. For 4 seconds. Like, breathe in for 4 seconds, out for 4 seconds, hold for 4 seconds, and out for 4 seconds. You want to pray and meditate for 2 minutes. I do that. You want to remind yourself this is just information and it's not your whole identity. You want to visualize yourself calmly answering the question. Happy place. Visualize yourself in a happy place. Visualize your past. Happy thoughts, positive thoughts. It helps. Mindset helps a lot. Now, during the test, if you panic because, it happens, you close your eyes, breathe for 10 seconds, and continue. Now, because it's like NCLEX, you can like skip a question and come back. Go with your gut. If you don't know even some of the words, you might not understand some of the demo, you've forgotten it, just pick whatever your mind tells you to pick and move on. Don't get stuck on that question. You have 150 questions, so move on. There are some you'll be very confident and you'll move on quickly, and then some you're like but this one's right now. Don't panic. Read the question twice before answering. Trust your first instincts. Don't overthink it. Anxiety is normal. Even every nursing student feels it. You're not alone in this. Now, tip number 7, you want to use memory tricks. Quick memory aids for common diagnostic topics. ABC, airway, breathing, circulation. Always prioritize in this order. Add by assessment, diagnosis, planning, implementation, evaluation. Your nursing process. The top 5 rights of medication administration, but I know it's more than this, but top 5 rights is right patient, right drug, right dose, right route, right time. Race is for fire, rescue, alarm, contain, evacuate, fire safety. You want to create your own mnemonics for topics you struggle with. Sometimes I also do singing. Singing helps because I have a lovely voice. So I sing it and, it sticks. You make it catchy, like you could also remix it with your favorite song, like WAP, and you could think of something that works with that. However you want to do it, do you. Tip 8, you want to read questions carefully. Now, common diagnostic test mistakes is rushing through the questions, not reading all answer options, or adding more. I used to do that, but now I don't do that, thank God. Or adding scenarios to the questions where there are no scenarios, or reading, putting more than there should be. Missing keywords like first, priority, best, choosing what you want versus what is correct. Now, slow down, read twice, answer once, move on. Tip number 9, answer every question. Never leave blanks. Even if you're guessing, guess away. Mini, mini, mani, more. I've done it. I've had my mini, mini, mani, more movement. And sometimes it works. And other times, not so much. Not now, though, but when I was more in my sophomore year, I had a lot of mini, mini, mani, more moments. But not anymore. I've grown. I've grown. But as someone who has experienced that, look for, basically eliminate obviously wrong answers. So I do that process of elimination. I'm like, definitely not. And then I'm like, okay, it's between these two. If I don't know which one, I go with my guts. And even if sometimes your guts does not so now say you do many more. Not that it's advising you to do that, but look for clues in the question. Choose the safest option and make sure the answer matches your topic. Make sure it's ask yourself, is it desired? Does it promote safety? No. And trust your nursing judgment. You're literally a nurse at this point. Nurse in the making, so trust your nursing judgment. A guess has a chance, a blank is automatically wrong. Failure. Ding ding ding. Tip number 10, positive mindset. Faith and positive mindset. Finally, and most importantly, I am a big advocate for mental health and mindset shift. Your mindset matters. Before you test, pray. Lord, I have prepared as best as I can. Give me clarity, peace, and wisdom as I take this test. Help me remember what I've learned. I trust your plan for my nursing journey. Amen. Any simple prayer, it doesn't have to be perfect. It can be short. You're like, Lord, I'm about to write this exam. Help me. Anything that can help. One of my favorite scripture in the Bible, from the Bible, is Philippians chapter 4 verse 6, which says, do not be anxious about anything, but in every situation, by prayer and petition with thanksgiving, present your request to God. Ask and it shall be given. You're capable, you are prepared, you are going to do great. This test does not define you, it's just one step in your nursing journey. Now, those are the 10 essential tips for preparing for your diagnostic test. Let me know in the comments, what is your diagnostic test? What topic are you most nervous about? What other nursing school contents do you want to see? If this video helped you, calm your nerve, even a little bit, then I did a great job. So please give it a thumbs up. Share to every other nursing student that needs it, because I do not gatekeep. No gatekeeping. And subscribe. I post study tips, nursing school real talk, study with me series, and faith-filled encouragement every week, either by shorts or by long-form videos like this one. We are building a community of empowered, confident nursing students here. Remember, you are prepared, you are capable, and you are going to show up and do your absolutely best. I framed that wrong. You're prepared, you're capable, and you're going to show up and do your absolute best. That is all anyone can ask. Now go get some rest. Take care of yourself. Trust the process. I'm rooting for you. You got this. So stay blessed, stay focused, and I will see you in my next video. Bye. Best of luck. You got this.